Age-related macular degeneration is the leading cause of blindness in people over 55, and that's according to the American Macular Degeneration Foundation. Now, this morning is our third part of our dry eye series as we continue our look at ocular health with a focus on dry eye syndrome and macular degeneration.
That's right. So with us this morning is Dr. Ed Paul from the Atlantic Medical to provide us insights into this disease and treatments as well. Good morning, Dr. Paul. It's good to see you.
Good morning.
Exactly what is age-related macular degeneration?
Well, age-related macular degeneration, more commonly referred to as AMD, is a degeneration of the macula, which is the center part of the eye. And what's really devastating about this disease for patients is it steals their central vision. So a patient with AMD starts to lose their ability to see the face of a grandchild. Their inability to read is sudden onset, and they lose their independence because they can't drive any longer. So really a devastating disease.
And you know, we're always asking our viewers here on the Balancing Act to write to us about issues that are important to them, and we've been getting, Danielle and I have been getting a lot of emails regarding
this. A lot of feedback on this one, yeah.
A lot of feedback, and we've got one here from Monica Jacobs. She's from Los Angeles, California, doctor, and she wants to know, how common is AMD? Can you answer that?
Well, right now we have 15 million Americans who have macular degeneration, and the National Eye Institute says that this disease is at epidemic proportion, and they suggest that by 2020, the prediction is that the numbers will double. So very, very devastating for our aging population.
Why? I mean, what causes it and who is at risk?
Well, there are still more questions about macular degeneration than we actually have answers, but here are some things that we do know. We know, hence the name age-related macular degeneration, that it's a disease that primarily strikes those over the age of 55. We also know that there's a slight predisposition for women, roughly 3 women for every 2 men. We also know that genetics plays a part in that. If you are lighter skinned and have blue eyes, you're at greater risk. And if you have a family member with macular degeneration, mother, father, brother, sister, some studies suggest that your risk factor can be increased by as much as 50%. Then there are a few lifestyle things such as obesity and our diet and also uncontrolled medical conditions. But still, we're working vigorously on this disease right now, and we hope that there's some future in sight.
All right, so teach me here, and Danielle for that matter, because my parents are sometimes even telling me, oh, I've got to fix my glasses, I'm not seeing as well. What are the signs? Because I actually want to know for them. And how is it diagnosed?
Well, most patients who develop macular degeneration simply go into their family eye doctor thinking that they need stronger glasses. They notice that reading the newspaper has become more difficult, maybe seeing street signs down the road is a little more troublesome, and then they go in and they get the dreaded diagnosis that macular degeneration has struck.
So let me ask you this then, is there anything that one can do to prevent it, to reduce the risk, to slow down the progression?
Yes. Earlier this year, a new prescription nutraceutical or eye vitamin became available called Tozal, T-O-Z-A-L. And in clinical trials done on this specific vitamin that's specifically for macular degeneration, we found that 56% of patients who took this vitamin for at least 6 months, who had already been diagnosed with the disease, actually had a significant improvement in vision. Another 20% did not have necessarily an improvement in vision, but had the disease stabilize and go into an arrested state. So over 70% of patients who took Tozal for at least 6 months and had been diagnosed with the disease had stabilization of vision or had an improvement in vision. That's really remarkable because up until now, there's been very little we could do for this disease.
And something is better than nothing. We're not talking about a cure, but obviously something that at least helps slow down that progression.
So then there is no cure?
No cure.
Well, exactly. Right now there is no cure. I will say that we are working on therapies with gene therapy and with stem cell therapy. We're hearing a lot about that in the news today, and we think and we hope that in the future that will be a cure for macular degeneration. But as it stands today, taking a vitamin like Tozal is the patient's best option for preserving what vision they have left and hopefully even reversing the vision loss so that they can gain a little more activity. And the big thing about these senior citizens who have the disease is they're losing their independence. And we want to do everything we can to keep them as independent for as long as they can.
My grandmother drove until she was 96 years old, and she wanted that independence.
Exactly.
And they all do, yes.
Exactly.
Yes.
It's so important.
It is, it is.
Well, thank you for coming by and sharing this information with our viewers this morning, Doctor.
Thank you, ladies.
Good to see you.
It's been my pleasure.
Thank you, Doctor.
And make sure you keep watching our Dry Eye series as we provide even more insight to manage your eyes. And if you want more information on age-related macular degeneration, simply go to the website.
And that's TozalRx.com. Check it out.